what we've been hearing from learning community members through various channels is that many of you want to hear from each other about how your programs are going, the lessons that you've learned, and how you've adjusted your approach over the years or months that you've been doing this work. And that's how these quick talk sessions came about. Our purpose today is to highlight the work of learning community members who have graciously volunteered to tell us about their programs with 5-minute quick talks, and then facilitate small group discussions in breakout rooms later, where you all can share your experiences with the Partnering for Vaccine Equity initiative. All of our learning community speakers are representing organizations that have entered their second year of PAVE funding. So part of what we'll focus on is how programs have evolved from one year into the next. Before we go further, I'll do our typical quick review of how this session will work. Things are a little bit different if you've gone to others of our events, because we're using Zoom meeting today rather than Zoom webinar, because we will have some breakout sessions. So you are muted upon entry to this meeting, but you can come off mute on your own. You don't have to raise your hand or ask us to do that. But we do ask that you please stay on mute unless you are speaking, just to keep us from having accidental interruptions and keep the speakers moving. We will use breakout rooms, like I just mentioned, for discussion after the quick talks. And when it is time to move to a breakout room, you'll be randomly assigned and then automatically sent to one. So you don't have to do anything, and you'll be automatically called back to the main room at the end of that breakout period. And the chat room feature is also open today, and we encourage you to use it to introduce yourself and or to type a question for our speakers at any time. We won't be doing Q&A after each short quick talk, but speakers may be able to answer some questions over chat. And we've also reserved a little bit of time at the very end of this session after the breakout discussions for a general Q&A when we're all back in the main room. We offer live interpretation from English to Spanish during our events. If you'd like to listen to the Spanish language channel, simply click on the globe icon in the Zoom taskbar at the bottom of your screen. And finally, as with all of our learning events, we will post slides and recording of this event, including recordings of the breakout room discussions, to our community website, and then we circulate those through the digest that go out through the CDC-managed Adult Vax Program listserv, which hopefully all Partnering for Vaccine Equity program members are a part of. So if you have any technical difficulties at any point during the session, please send an email to this address here at the bottom, vaxequitylearning@urban.org. We'll do our best to monitor that during the webinar, and certainly we want to know about those technical difficulties, whether they are live or after the fact, so that we can try to fix them and make sure that doesn't happen again. And now it's my pleasure to introduce our featured speakers. And I'll do this in the order that they will be speaking. So Paris Thomas is a co-executive director at Equal Hope with more than 10 years of experience in healthcare programming, healthcare community programming. As co-ED at Equal Hope, and specifically for community health innovation and health equity alliances, Paris shares the responsibility of overall operations, finance, resource development, and program management. She has a Master of Science degree in Community Health from the University of Cincinnati, and she's also a Health Sciences PhD candidate at Northern Illinois University with a dissertation that's focusing on community violence and health disparities. Welcome, Paris. Carol Lemus is the Assistant Vice President of Health for Lantern Community Services. Carol has more than 30 years in the areas of community health, particularly in substance use, and she's worked both nationally and internationally to improve quality of life for marginalized populations. Carol is a subject matter expert in harm reduction principles, as well as program administration and peer-delivered programming. And she has her MPH from New York University. Bernard Macklin is Outreach Education Vaccination Coordinator for CARE, Southern Connecticut State University. He's worked for more than 12 years in the areas of medical administration, public health, and legal administration, and his current role is focused on medical equity through vaccinations of COVID-19 and influenza in Black and brown neighborhoods in New Haven, Connecticut. He creates educational materials, conducts community listening sessions and surveys, and organizes vaccine clinics with the goal of addressing determinants of health related to COVID-19 and the flu. And Andrea Murray is a project manager in the Department of Medicine at Penn State College of Medicine. She has expertise in rural health, racial and ethnic minority health, and social determinants of health. She manages projects funded by NIH, Patient-Centered Outcomes Research, known to a lot of us as PCORI, and the Centers for Disease Control and Prevention, or CDC. In addition, she serves as the Director of Community Engagement, and in this role, she works to identify and strengthen community academic partnerships across Pennsylvania communities. Right, so that's a great lineup of speakers, and we'd like to get to the quick talks right away. So thanks for sharing your experiences with us, all of you in advance. Paris, the next slide is yours, so you can begin whenever you're ready.
All right, good afternoon, everyone. My name is Paris Thomas, and I'm representing an organization called Equal Hope. Our project with the CDC was titled Addressing Vaccine Hesitancy in Metropolitan Chicago. Strictly, Equal Hope is a nonprofit organization based in Chicago that serves both Cook County and Lake County of Chicago, Illinois. Our past has strictly been focused on women's disparities and women's health disparities. Obviously, with COVID-19, we pivoted our services to serve the community in a more holistic manner and make sure we are addressing the disparities and mistrust around COVID-19. So our target population is low-income Black and Hispanic individuals with chronic health conditions living in underserved communities. In an overview of what we do, we fight health disparities around COVID-19 through outreach, education, and navigation to COVID-19 resources, including vaccination, education, and those things. So with our year one funding, some things that we did, we hosted a COVID-19 TikTok messaging competition. And what that consisted of us getting younger audiences engaged in COVID-19 kind of education and coming up with creative ways to get that messaging out there. We did pick a winner, and they actually got $1,000 for this competition, which was great. We also did COVID and influenza community campaigns with our community health workers. We have a host of community health workers that go out in the community and train what we call health ambassadors. These are just kind of advocates in the communities we serve to go out and continue the education and reach even a larger audience. Another strategy that we did with our year one funding was a weekly radio show and commercial promotion on WVON and WRLL, which is one of Chicago's largest urban reaching audience. So we have a Saturday show at 11 a.m. with a wonderful host where we have COVID-19 physicians and experts, and even right now, those who have long COVID symptoms come on and talk about kind of their experience and provide education. And it's really great for the community because it allows them to call in and give their own opinions, and the doctors get to dispel a lot of myths. So a lot of things around COVID-19, specifically when we have those conversations, we have a lot of callers, and it is a great audience to reach. And with that, we're reaching about 15,000 individuals every week. So then we also did COVID-19 and influenza social media messaging. As with the TikTok, we wanted to get other audiences much broader. And so we did so through Facebook, Instagram, Twitter, and all of that, and came up with a campaign along with our NIH field partners to really push that education out there. And then the other thing we did here with our funding was the provider vaccine education on the state vaccine registry. A lot of providers that weren't using it, we really did a lot of education to make sure that they were using it and putting in those that were vaccinated, so we could have a really robust number of those who weren't vaccinated and understand the data here in the Chicagoland area. We can go to the next slide. So goals for year two for Equal Hope includes creating a web page for healthcare providers to download information for patients, which is currently in the works. We are currently remodeling our website to have resources, as we currently have another page of like cancer resources that a lot of providers trust in us. So this is a really big thing that we want to be able to provide providers about long COVID and about the treatments and things like that they may have questions. This will also be for the community, and there will be handouts that other community-based organizations can use in their outreach. We are also training additional community health workers and trusted messengers such as pastors and first ladies and people really in the community on COVID-19 through our educational curriculum. We are also creating 2-second PSAs on COVID-19 and influenza. We have a really strong cast of the PSAs that we create being disseminated here in the Chicagoland area. We've had them played in health center waiting rooms. We really promote them on social media, and even so, they get to be promoted on our radio show and then also our monthly television show on CAN TV. So Then we're also creating COVID-19 and flu promotional materials in English and Spanish as we did in year one. We're also hosting monthly webinars and attending community events to promote vaccine awareness and also continue on with our social media and outdoor advertisement campaign for COVID-19 and influenza. And that doing so, we are actually have community health workers that are really canvassing and walking around the communities that are really disconnected from healthcare and providing them education and having open dialogue. And the great thing about this is that we're using community health workers who are from the community and culturally aligned and have had their own hesitancies with the COVID-19 vaccine. And so it becomes an open dialogue where people feel comfortable to have these conversations and then engage in, education. We're also creating new partnerships with youth-based organizations to promote our vaccine uptake and engage our partners through e-blasts and newsletters. Some pearls of wisdom that we're applying from year one would be that personal stories and community-driven approaches to education really do work. As I mentioned before, our community health workers that are from the community, we have found that they are the most impactful because they have their own hesitancies and they can really relate to people's hesitancies and distrust and mistrust and allow for a really open dialogue because they understand where everyone is coming from. Two, we are not just promoting the vaccine, but we're building community trust. Historically, the populations that we serve have already had a distrust of the healthcare system, but with obviously COVID-19, we've seen that increase drastically. And so we're really, really focused not only on just like pushing the vaccine, but really understanding people's perspectives and finding out ways that we can really build that trust and put interventions in place to help people build up trust, because the vaccine isn't the last thing that they'll have, and there'll be boosters and additional things. And now with monkeypox, we want to make sure that we can get our audience vaccinated and safe through these pandemics. We can go through the next slide. And then so some discussion topics that I thought were interesting was just to see what other people are doing to encourage the COVID-19 vaccine among the unvaccinated with high rates of transmission among those who are vaccinated. And then encouraging the use of COVID-19 medication for those in need and increasing provider knowledge on that. Because we are seeing that a lot of providers here aren't really providing education around that. And we've kind of done a survey and they said they didn't have all the knowledge or feel as comfortable to really talk about some of that. So I wanted to see what anybody else was doing around that. And then also COVID-19 strategies to continue engaging the community. And that is it. And that is Equal Hope. Thank you.
Thanks so much, Paris. And now we are ready to turn it over to Carol.
Hello. It would help. Can everyone hear me?
We can hear you. I can hear you.
Okay. My name is Carol Lemus. I'm the Assistant VP for Lantern Community Services in the area of health. Our program is called On Point. Lantern is primarily a housing agency. We have 16 supportive housing sites as well as a number of shelters. In year one, we focused on our supportive housing sites using a key influencer model. So we actually trained tenants within each building to be the messengers. And then through partnerships that we have with not only governmental entities, but community-based organizations and businesses, we are bringing vaccinations to our sites rather than sending people out. When we started, we have 1,150 people who are program tenants in our supportive housing sites, plus 600 community tenants who are living in the buildings in low-income housing. So it's a mixed population. Most are formerly chronically homeless, facing mental health challenges, chronic health conditions, substance use issues, as well as young adults aging out of the foster care system. largely people of color, 64% Black, 33% Latino, Latina. Our largest group is between 45 and 64. We do have the next largest group between 24 and 44, and the other ages are kind of distributed evenly, and about 83% are currently unemployed. We also were looking at impacting our staff. When we started the year and COVID vaccinations became available, when we applied for this funding, our tenants had about a 12% vaccination rate. Our staff had about a 23% vaccination rate. Next slide, please. So what do? We have these trained tenants, and they are our vaccine ambassadors. We also have trained staff that are our vaccine champions. Staff rates, we stopped tracking when New York City mandated that all agencies with city contracts had to have their staff fully vaccinated. So that kind of took care of our low vaccination rate among staff. But our vaccine ambassadors, through doing outreach education, information tabling, like you can see, they designed this board. Those are two of our vaccine ambassadors. They hold discussion groups, and we have on-site vaccination clinics. They kind of coordinate and promote them. So within our first year, we raised our vaccination rates from 12% to 76%, which is amazing. It was all done through influential messengers. We trained a total of 50, and as far as we could track, got about 733 vaccines administered for COVID. It's a little harder to track the flu vaccines. I don't think 98 is really reflective of what actually happened, but we've tightened up our tracking for year 2, so we'll have a better idea. Next slide, please. So our goals for next year, we're adding our 3 shelters in, which is another 375 homeless adults. Most of our vaccine ambassadors wanted to continue into year 2. So we did train a few more. Also in the shelters, because of the transitory nature of the population, we're working instead of with resident or tenant outreach workers, we have on staff peer engagement specialists that are delivering the services in the 3 shelters. Pearls of wisdom, we need to improve our vaccine tracking. We've started that, cleaning up our building rosters, because people do move out. Unfortunately, people do pass on. And we need to improve our tracking with community tenants, because we've been tracking in our database, and our database only reflects people who are designated as program tenants. So being a tracking system that will be tighter to track the vaccinations among community tenants. We've also identified through our trackers in each building which tenants are still needing a primary series, and we are going to be doing targeted outreach to them. using motivational interviewing. We've trained our vaccine ambassadors on MI techniques, and we will also be present at all other building activities. We, for example, provide a fresh food box where people can get fresh produce on a weekly basis. So we will be present during the fresh food box to also deliver those messages. And next slide, discussion topics. With a limited, relatively stable population, how to address issues of COVID fatigue, both among our vaccine ambassadors as well as our target population. Their challenge is they live in the same building with the people they are targeting. So these are their neighbors. They want to maintain good, positive relationships with their neighbors. So it is always walking the fine line between motivating and nagging. And nagging clearly is not the best route for us to go. As media attention has been reduced around COVID, we've seen concerns about COVID also being reduced. Also looking at what we might be able to do to track ongoing conversations with the same individuals. Because it is a stable population, to really look at conversation to conversation, what is working, what's not working, and where we might gear our future conversations with them. And then how to broaden the intervention focus so that vaccination is part of a larger discussion on health maintenance and harm reduction, with always within a health equity lens. And I think that's my last slide. That's how you can reach me. If you have any questions or concerns, please feel free to reach out. Thank you.
Thank you very much, Carol. And we'll make sure that all of the attendees have access to the email addresses and contact information for our speakers today. All right, Bernard, are you ready to go? The next slide is yours.
I am ready to go. Hello, everybody. My name is Bernard Macklin. Me llamo Bernardo Macklin. I work with the Community Alliance for Research and Engagement here at Southern Connecticut State College of Health and Human Services. Just get straight to the point. We actually work within the districts right here in New Haven, Connecticut. We look forward to working with Black and Brown people, considerably Black, African American, Hispanic, and Latinx low-income populations. We work towards increasing COVID-19 vaccinations here in New Haven by implementing extensive grassroots outreach strategies and educational campaigns, increasing access to vaccinations, again, once again, amongst Black and Latinx residents. Next slide, please. Within the first year of funding, we have extended our COVID campaign and flu outreach staff just to ensure we have enough people to surround all the districts within the communities that we work in. And we also work very hard to leverage continuous funding from other grants to expand on training and outreach, so all folks within our districts are knowledgeable as it relates to COVID and the flu vaccines. We have trained more than 50 plus trusted messengers and leveraged their extensive networks to engage residents, just to ensure people that live within these areas, people that actually work within these areas become trusted messengers, so people that know them will believe in actually the information that we are putting out into community as it relates to COVID and the flu vaccines. We've contracted over 15,000 people during this time and made 3,000 vaccine referrals and attended over multiple up to 1,000 events during this time. We developed here in New Haven vaccine clinics and outreach collaboration tool. This tool is used to ensure that we're not operating in the same neighborhoods. So if we're not working together on that particular day, we know through this tool where people are going to be, exactly where they're going to be, so we're not overbearing our residents with different messages if the message is different, so people are getting a consistent message in our communities. We developed a community-friendly COVID-19 flu website that was created by our own Jackson Higginbottom, who will be speaking here on the next slide, to help people to have an easier website to go to receive multiple levels of information as it relates to multiple issues, definitely with COVID updates, vaccine locations, and the rumor log, because you know it's a lot of information out there that is not necessarily true. So we provide through our website where they can go in and actually put rumors, but also see all the rumors and get information related to those rumors. So we're not putting out false information in our community. We work so very hard to organize vaccinations and outreach activities throughout New Haven. Activities organized to increase vaccine confidence and uptake. A lot of people are hesitant, especially within the communities that we're working with, due to multiple other reasons outside of this particular pandemic. So we work very hard to make our residents confident in the information that we provide, so they're not hesitant to be vaccinated. On this next slide, I'd like to introduce my good friend and my coworker, Jackson Higginbottom, who would describe the next two slides, please.
Hi, everyone. Thanks, Bernard. So this is our goals for year 2. So really to expand on trusted messenger trainings that Bernard mentioned, to include the staff of our partner organizations that we've been working with, to expand the trainings for New Haven residents and other community leaders. Really, another goal for year 2 is to reduce the barriers to vaccines that we've identified in year 1, primarily around information barriers, such as access to an accessible website for information, through printed materials, social media, and the outreach activities that Bernard oversees. And then we also work to reduce barriers around logistical barriers, such as hosting mobile vaccine clinics. And one new barrier that we've identified with the pediatric vaccines was that some clinics only offered pediatric vaccines. And so for kids or for families that have, little ones, and then also they may need a booster. It's been difficult for some of them to, have to jump around to different clinics to get all the vaccines. And so that was another logistical barrier that we're working on. And then lastly on this slide is to increase vaccination opportunities in coordination with other social and health resources. We have found that at this point, at this stage in the pandemic, many communities are tired of hearing just COVID stuff. And so, there are many other issues going on in people's lives that they need resources for. And so we've started hosting events that included other social and other health services and resources. Next slide, please. And so here are some of our pearls of wisdom that we are applying from year 1. First off is standardizing training for community trusted messengers across New Haven. We have found that it was extremely important that we have all the different organizations that are conducting outreach in New Haven to have the same training, to make sure that we all have a unified message in what we were talking about when we're doing outreach, and just that we are all aligned with the information that we're sharing. Our second pearls of wisdom was the importance of community-wide collaboration. The New Haven Health Department, we've helped organize a weekly meeting with the health department and vaccine providers and other community-based organizations that are conducting outreach in New Haven, hosting vaccine clinics. And this has really helped us identify areas in New Haven that were not getting not having vaccine clinics equitably, making sure that the neighborhoods that have lower vaccination rates, that we are making sure that they had access to more mobile clinics and other alternative vaccine clinics, so that they that is not a barrier for these neighborhoods. And then we launched a New Haven vaccine clinic and collaboration tool, and this is where all of our partners can report the different outreach that they're doing, and also the where they are hosting clinics. That way we are able to see both where are we going out and doing door knocking or canvassing or hosting tabling events, and also where we are having vaccine clinics. And so this allows us to make sure that all these neighborhoods are being getting access to this information. This really drives me, or this really takes me to point 3 around data-driven approaches to outreach, specifically informed by residents in those communities. So, just having data-driven approaches is not enough, because, if we are continuously bombarding certain neighborhoods with outreach and information, people get overwhelmed and really, react to that type of engagement. And so we found that it's really important to make sure that it's informed by residents. And so, if residents feel like they're being overwhelmed with information and resources, we kind of back off on those neighborhoods for the time being, and we'll come back to them. And so that's really some of our high-level pearls of wisdom from year 1. Next slide, please.
And with that, with the discussion topics that we look to, sustaining meaningful collaborations with our partners. Discussions of the challenges with maintaining and meaningful collaborations are so important. We realize that this is a work that we cannot do alone. So we reach out to our partners constantly, looking for other areas that we can strategize together to inform our communities together, so they see a collaborative effort. We also want to strategize for keeping communities up to date, discussions of strategies used to keep communities updated with the latest information. So we're very connected to our state public Department of Public Health and the CDC to also make sure that we're providing information that is actually factual. This is information that the community asked of us from the very beginning in our listening sessions that we have with them, that they give us information that's actually true. There's so much false and misleading information in our communities. That's why it's so important with our partners that we provide them with actual updated information that's true. And strategies for keeping community engagement. Discussions of community engagement strategies used to encounter this pandemic fatigue. People are tired of hearing about COVID. As we said before, we want to move away, and we actually connected with community agencies to provide other services along in our clinics and in our canvassing, so we can keep our messaging entertaining, factual, and up to date. Next slide, please. If you would like to reach out to CARE, you see myself, Bernard Macklin, and Jackson Higginbottom as people that you can approach for more information. Thank you so very kindly.
Thank you, Bernard. Thank you, Jackson. And last but certainly not least, we have Andrea. Go right ahead whenever you're ready.
Great. Thank you so much, Bridget. Hi, everyone. Andrea Murray here from Penn State College of Medicine. I'm going to talk a little bit about our project that we have really spearheaded by our REACH team here at the Penn State College of Medicine. So our location right now in year 2, we're actually working in 10 counties in East Central Pennsylvania, which you can see those 10 listed. However, in year 1, we only focused on our 2 main REACH counties, Berks and Lebanon. So you'll see a little bit of difference in between year 1 and year 2 in the work that we're doing. Our target population for our REACH project and our COVID-19 and flu vaccination project is the Hispanic and Latino communities located here in the East Central Pennsylvania region. So what do? Over the past 2 years, we've been educating and equipping community champions with community tested educational and outreach materials. We're also working with our community partners day in and day out to make sure that everybody that is interested in receiving COVID-19 vaccine or a flu vaccine is receiving that vaccine in a timely manner. We're working alongside with our Hispanic and Latino community champions to make sure that our materials and our education that are provided are well written and facing the Hispanic and Latino populations in a way that they can understand as well. So with our year one PAVE funding, we were able to engage over 1 million people, and that was just in working with Berks and Lebanon counties, but then obviously spreading out through the state of Pennsylvania. We created 12 educational materials, these in more of an infographic setting, and also 78 culturally appropriate communication products. So ranging from social media videos to yard signs, to billboards, to bus ads, to anything that we could put out into our communities that were appropriate communication products for the Hispanic and Latino population. And then also in year one, we assisted in vaccinating about 1,236 individuals in Berks and Lebanon counties. Those numbers growing as we work in year two here and working with larger companies like Bell and Evans, a chicken production farm, and also Giorgio Mushrooms, where we worked with both of those organizations to help vaccinate all of their employees that were interested in the vaccine. The materials that I talked about that we created and we used with our community educators can be found there at that website. These are all usable and shareable by anybody that visits our website. We also encourage people to co-brand with us, because when our community partners see a brand or a community organization that is familiar to them, they typically trust that material a little bit more. So I also put that there in the chat for you as well to take a look. And if anybody's interested in using any of those materials, you can always reach out to myself. We have some native files that can be edited to add your information and also your logos for your own community partners. Okay, next slide. So what are our goals and activities in year two? We really focused on conducting a mixed method needs assessment to identify the drivers of COVID-19 and flu vaccine hesitancy, continuing to educate and uplift our influential messengers and provide community acceptable approaches to COVID-19 and flu vaccines. We expanded our Protect Yourself, Protect Your Community vaccine hesitancy campaign by equipping influential messengers by educating and empowering trusted voices in the community. We went out into our 10 counties and we asked, who are the people that you trust? Who are the people that you go to when you have questions about your health or anything else that you might need in your own social circumstances? We also really looked at engaging underrepresented or disadvantaged populations in vaccine education and outreach. We're currently working with our WIC offices in 2 of our counties to really focus and target on the pregnant population and the Hispanic and Latino population. As we know, these women tend to be the most hesitant about receiving the COVID vaccine during pregnancy or after pregnancy while breastfeeding. And so pearls of wisdom that we're trying to apply from year one, it's really including stakeholders in the creation and dissemination of educational and communication materials. We find that when we share our materials with our communities and we receive the feedback from them, making changes or listening to what they have to say make our materials and our education even more beneficial for our community partners. And then again, also focusing on those underrepresented or disadvantaged populations, focusing on the WIC populations, which include mothers of young children, and then also focusing on DPP populations. So those folks that provide diabetes prevention classes, we know that they serve a lot of folks out in our community and tend to be folks that are answering questions from our community members. So educating DPP educators as well as we move forward in year two. And we can go to the next slide. And so we're thinking about some discussion topics and some questions we might have for you and things that we're thinking about here at the Penn State College of Medicine as we keep educating our community, really focusing on that underrepresented or disadvantaged population, thinking about more engagement methods, what works, what doesn't work, the partnerships that we can create in these communities, and then utilizing more audience testing. All right, I think I'm done.
Thank you, Andrea.
Awesome.
And thanks to all of you. I know it is never easy to fit anything into 5 minutes or have a 5-minute goal. It's sort of a speed dating for PAVE. So I appreciate your work to really try to capture all the work you're doing in a short period of time. Okay, so we're going to head into our breakout sessions now. Like I mentioned, you don't need to do anything. You'll be automatically sent there. We need at least a few minutes for kind of a report back and to all gather at the end. So I'm gonna set these for 10 minutes. We kind of were wavering 10 to 15, but let's try 10. And hopefully that will be enough time to have a in-depth discussion, at least about a couple of these discussion topics that you've been seeing during the presentation. So Zara, feel free to start the breakout process now and move us to where we need to go.
And just give me 1 second. I'm sorry, I'm trying to pull it up. My computer shut down on me briefly. Okay, so the first question is, with COVID fatigue at a high in many places, what are some promising approaches that you use to continue engaging communities around vaccination?
One of the things that that we're trying to promote is that at some point people just stop coming out for the vaccines at our vaccine clinics. So we're not calling like we've got an event coming up next month, and we're not calling it a vaccine event. We're having health fair. But at our health fair, we will have COVID information, and we will also have vaccines available. And we're hoping that people will get the vaccines because they're there and available.
Thank you for sharing. Anybody else want to share? I can say for our group, we are currently doing COVID-19 surveys as well and giving gift cards. And so that's kind of a way we're kind of reeling people in with the COVID-19 fatigue. We're really trying to understand, you know, long COVID and really where people are. You know, in the beginning, we were like, would you get the vaccination? Now it's more, a lot of people who are vaccinated in our community are like, yeah, I'm not getting a booster. And with additional boosters being encouraged, and even with kind of, you know, monkeypox on the rise, we've asked questions about that, and people are like, I'm definitely not getting any type of vaccination or anything for those type of things. So we're really trying to outreach and spread our way through that. I can move to the second question. It is, what are examples of effective ways to track ongoing conversations with individuals in your community?
Is anyone trying to do this with the kind of direct outreach that your programs might be doing? I was wondering whether this was kind of maybe a more unique thing for folks who, some might not even be trying to kind of track conversations with sort of face-to-face conversations.
Well, I'll speak for our organization. We haven't done anything like that. We've had, we had a town hall where we've had a couple of town halls where we had people, like we had a physician who talked about the effects on the body, different ways you could be affected. We have a support group, a COVID support group that we work with. And some of the members of our support group are long haulers. So we had different activities set up for them. We had been having them virtually. I know we did schedule a time to do some yoga. And we've, I was going to mention also that we've also done surveys. Like when we have our vaccine clinics, after the people get their vaccines, you know, we have other providers there with other information. And then we have a survey for them. So, and we give them $25 gift cards for each vaccine, not just the first dose, but if they got a COVID vaccine they completed the survey, then they were able to get a gift card. And then we did a focus group on COVID information and misinformation, and we had another survey on SurveyMonkey on COVID information, wanting, just trying to understand where people are getting their health information, who they're believing, who they believe is telling them the truth. And it was surprising the number of people that said they get their information from their mom and also from doctors, CDC, and World Health Organization.
Yeah, we did.
Testimony.
I was going to say, we've done similar tracking like that. Currently, when our community health workers are out getting kind of the opinions of the community, we're tracking it in Word. We do have an IRB out as we're moving into more surveys around mistrust and distrust. So we're going to formally do qualitative interviewing to really collect that so that we can move forward and kind of disseminate that and really understand. Because for us, I think it's not just about COVID. Distrust and mistrust, there's plenty of other reasons why people aren't accessing healthcare. Here in Chicago, over 80% of the women we serve do not have a primary care provider. So there's more than just COVID. They're not getting all these other things addressed, and we really want to understand the barriers to that here. And that's why we're going into qualitative interviewing around, racism in the healthcare system. We're bringing up those type of topics to see if it encounters, because I specifically do qualitative interviewing around that, and I've heard experiences of men who feel like they can't disclose what community they grew up in, or if they've been shot, because they feel like they're already being judged as being a minority in the healthcare system, talking to a provider that doesn't understand where they're coming from. So we're using some of this to kind of, look at the system as a whole and see where we can really strike and make a difference and kind of improve this. Does anyone else want to share maybe how they're also tracking kind of the audience and things they're hearing in the community? Okay, so then we'll move on. How are you all keeping your communities up to date with the latest COVID and flu information?
Okay, I got an answer for every question, okay? It's gonna be you and me.
All right.
I'm like, it's you and me.
So we have a great social media presence. And so we are posting information on our Facebook page, our main page. And then we also have a COVID page. And so we post things there. We have other social media outlets, but Facebook is the main way. Although I will say we get a lot of traction out of our posts on LinkedIn. We get a lot of response on LinkedIn, and we also have monthly mailings, and so sometimes we're sending information, COVID related information, and flu information out there as well.
They're really good. Any other ways maybe people are keeping updated? I know for a while we were creating flyers and this, and we were doing like a 10 fact sheet, but as things were transitioning, we're like, we can't keep up with the times and be able to produce new content and put it out there. So we moved to kind of like social media, and specifically finding creative social media strategies, like making whatever the TikTok trends that the kids are doing, we try to like jump on that and incorporate messaging within that to try to get it to go to a bigger audience. So we're trying to be creative in how we disseminate the up-to-date information. We're also working with bigger partners here in the Chicagoland area because we're a part of the NIH seal, and we're doing a lot of education on our community-based organizations that are smaller to really get them to disseminate to their audiences, because they're reaching audiences that are disconnected and disenfranchised from the healthcare system.
And we had a great billboard campaign. I will say that as well.
Awesome.
Yeah, we did 11 billboards. And they were very well received. someone liked our billboard so much that they had one put up again in a different location.
Nice. That's success. Real
Yeah,
success.
so that was pretty cool for
I know
us.
that felt pretty good.
I know we only have a couple of seconds left. Just any challenges that you also have experienced with maintaining meaningful collaborations with your partners during the pandemic?
No, we've had great, for us, we've had great partnerships and have been able to make new partnerships. So we're happy about that.
Anyone else? Any challenges? Any other additional things maybe anyone wants to add that their organization is doing? We have 15 seconds left.
You turn it on. Leandra, do you wanna do any intro or?
No, I think we can hop right into that first question if you want, just to get the conversation going.
Okay, you're going to record?
Yes, so we are recording right now.
And we do ask that everyone type into the chat your name and agency. That would be helpful as well. Am I seeing any? I'm going to wait until I see at least a couple of names or something in the chat to make sure that we actually have people here. I see you, Demetris. Thank you very much for turning on your camera. You are with?
I'm with Abounding Prosperity in Dallas, Texas.
Okay, thank you. Gina is with Casa de la Salud in Virginia. I am not going to try to pronounce. Is it Mungshi?
Yes, that's correct.
Yes, wow. Mungshi Kang, who is coordinator for the Hmong and Hispanic Communication Network. Paola Ortiz, La Clínica de la Raza. We have JJ and a phone. I'm not sure if they're there, but let's get started with, are there any of these 4 questions that resonate with some of the challenges that your organizations are facing? COVID fatigue, tracking conversations, keeping communities up to date on information, and maintaining meaningful collaborations with community partners. So if you want to type in or say any preference that stands out for you.
So I would like to say number 1, and I was actually quite interested in feedback from you, Carol, regarding how you trained your influencers. So for year 1 for us, we did a virtual presentation. It covered, COVID basics. It covered how to have conversations with individuals around engaging them about vaccine equity, et cetera, and so forth. But we're looking for year 2 to kind of revamp that conversation, because at this point, most people know their COVID 101s and things like that. So we're actually looking for more creative ways to have that, to host that training and to provide something more than the standard.
What we have done in the face of everyone being burned out on this was to bring in motivational interviewing. We have developed a short video scenario of what that might look like. And then the staff that kind of support each individual vaccine ambassador, because each building has a designated staff person that supports them, is doing role plays with them. Really to develop those the skills more around things like active listening, affirmations of what people have done so far, and really just doing that hands-on, give them a scenario or have them develop a scenario that was challenging to them and role playing how it might have been handled with MI, and having them practice how to revisit that. I see a hand up. JJ.
Hey folks, JJ, I use they and Z pronouns. I'm in Oregon. It's a combination of all four of these questions. So the way that we approach our COVID work is very similar to everyone. We've had an influential messenger like model for years. That's part of the like advocacy and organizing that Unite Oregon does. And so we kind of approach every community oriented situation with this model. So be it housing, healthcare, transportation, food, whatever. And so what we like to do is put folks in the community in front of folks in the community, because as you all have clearly stated, and you know, those who look like folks in our communities are folks who will get a better response than someone who was white, for example. That's not shade, it's just a fact. So what we've done is we've kind of tried to use our influential messengers in a way that allows us to track some of these metrics. We implemented some things like Carol just mentioned, like MI is a really big part of our influential messenger training and skill set and building that we do, just so that folks can feel confident enough to do that. And a lot of what we're getting now is, it's a combination of things, right? Folks are over COVID, which is real. Secondly, the access to prevention and treatment is limited. And if you live in a region like Oregon, for example, you are in a rural area. So you are more than likely having to travel for hours, if not a couple of days at times, to find access. And then even with keeping folks up to date, we all know the challenge with CDC. That is not shade, again, just saying. In terms of getting the right information, and then when you do get the information, how do you make this palatable for the communities that you serve? For some of us, we have to translate it. And sometimes it's not in a language that is easily accessible. And so that takes time within itself. And then to still reach those specific communities, there's still a barrier there because the language may not be up to date or it's not health literate enough, kind of, sort of. And then a lot of the maintaining the relationships is also contingent on just like the COVID fatigue that's happening generally. Like everyone is kind of over it, which is sad because now numbers are rising, more people are getting infected, and then here comes monkeypox. It's like, damn, can we get a break? And so like having to then do the education around that piece when folks are like, I don't care about, like, our response that we've been getting the last couple of weeks is, I don't care anything about COVID. We just need to know what's going on with monkeypox. And we're like, great. And we're still going to tell you about COVID because that's a reality and that's happening right now. And also we'll try to give you as much info about monkeypox or try to make it as close to that as possible. So sorry for taking up all the time, but that's kind of the reality that we're in. We're in this weird space.
Yeah, I agree too. This is Mengshi. I know with like COVID fatigue, that's something that we've been experiencing here in central Wisconsin also. But one way our team has been doing, like approaching a lot of our mobile clinics, is that they're just really sick and tired of coming to our clinics. And, so that's why we started implementing other things. So we did a Easter celebration with the clinic, and we had the Easter bunny come in with families, so that way their kids are allowed to come in and take photos with the Easter bunny. We had cotton candy. Like I personally had a cotton candy machine, so I brought it there for the kids. We had other organizations, community organizations, come in and do like face painting and
faces. I do want to shout out to Darylyn Rivera Colazo. She's with me with the Penn State College of Medicine. And so she's my project manager that really helps me with our COVID-19 and flu vaccine hesitancy program. And so we have actually, some kind of like leading questions that we can utilize for this breakout time. A really good time to hear about what others are doing and to provide some information back as we go back into our larger group. So the first question is, with COVID fatigue at a high in so many places, which we heard during a lot of our presentations today, what are some of the promising approaches that you've used to continue engaging communities around vaccination? So is anybody finding something that really works that maybe people aren't, saying, oh gosh, I'm so sick of hearing this over and over again? I'll go ahead and share so we can, oh no, Suzanne, go ahead. Suzanne, I'm sorry.
I was just going to say, it's not like new.
Yeah.
Because I know we're all doing the same stuff, and somebody actually mentioned it earlier, but community events are great where there's other stuff happening, like a festival or, there's other community resources being shared. So that's always like a non-in-your-face way that we do. And what we do also is, it's kind of tedious, but we actually at the vaccine pop-ups that we host, we actually take record of every person. We didn't always do this because it is tedious, but we're doing it. And then what we do, and then we mark just, we put like first, second, third, fourth shot, whatever, right? And then like we keep track of that and text them and say, hey, you're due for your third shot. And that is really working for us. That individual touch point.
That's fantastic. That's a really great engagement.
It's hard because again, not everybody's willing to give you, we have a very close-knit community. And then of course, we're all of us here are trusted messengers. We know what that means. So they'll give us their information, and so that's the only part that's tough, but it works. It works.
Great. Anybody else want to share what they're currently doing? Darylyn, you want to tell them a little bit about our WIC waiting room videos that we're currently doing?
Yeah, well, right now we are recruiting pregnant women in the WIC clinics in Lebanon and Berks. And right now we noticed that the best way to recruit these persons is with text messages, and the WIC clinics helping us with this because they are waiting, just 5 minutes in the waiting area, and they're not currently, in a hurry. They're currently in a hurry, so they want to go to the clinic, see the doctor, and just go out and just keep on with the day. So right now we are recruiting them just to see if they can evaluate our videos, currently videos that we did in Spanish and English, and to see what is, and we need that these participants doesn't have the booster or any of the vaccine in the series. So if this woman only have one vaccine, can be recruited in our study, and also if have the 2 doses but not the booster, can be recruited in our study. So yeah, basically it's for these participants to evaluate our videos and to see what they think about if we can, it's a pilot study. So it's just to see what, if we can do it better, how. And we also do a lot of questions in the survey. And after that, we have a focus group to see if these participants can be in a focus group and evaluate those videos. And
Great. Yeah, no, that's perfect. So we created some videos that are going to be played in WIC waiting rooms. And we recruited pregnant women that are WIC participants to tell their stories about them getting their own COVID-19 vaccine, or them getting COVID during pregnancy and why they wish they would have gotten the vaccine. And so we did these videos in both English and Spanish. And right now we're testing them with our population to make sure that we got it right. And if we can make any changes to them that they might deem necessary. And so we'll have those videos to share with everybody here shortly. Another question that we have is, what are examples of effective ways to track ongoing conversations with individuals in your community? So I really liked New Haven. They had that community tracking tool to make sure that people weren't, doing the same things in the community. Is anybody currently doing that with their own projects and tracking or working with other projects that might be focusing on COVID-19 vaccines?
So
I guess it's
you
sorry. Go.
Yeah, I haven't spoken. I'm the project director for our project. We're a prime organization, so I work with 16 different agencies around the country. So I don't have I'm not on the individual level like the rest of you maybe. But one of our agencies is using a tactic called geofencing. I don't know if any of you have heard of that, but they operate several community health centers, and they put a geofence on their community health center. So when patients come in and are using a mobile device, that will trigger a Google ad that then the Google ad will promote vaccines on their mobile device. And that Google ad then tracks them for the next 30 days. So the health center doesn't get, is not tracking them, but they will get this Google ad for the next 30 days, on other random things that they're looking on their phone or maybe on their Facebook feed or things like that, promoting vaccines at that community health center. So it's a way to engage with their patients without necessarily any employee from the community health center. Just Google ads will just be popping up on their phone and saying, hey, do you need a vaccine? Come to our health center, or click on this link to schedule an appointment. So I thought that was an innovative way to use technology. I mean, technology is following us whether we want to or not, but we might as well get it on our side.
That's super cool.
Little weird, right? But,
no,
but we might as well use the technology for our benefit, right?
Exactly.
Yeah.
Susanna, were you going to share something?
Yeah, that's super cool and innovative. Congratulations. No,
it's also very cheap. So yeah.
Google AdWords. Yeah, Google Ads. So no, what we do is, I don't know if everybody else can do this because again, every project is different, but we have we work with many nonprofits. We're all part of a collaborative actually in the South-Dade of Miami-Dade County area, but we are 6 key partners. We're all nonprofits, and they actually send me monthly reports. As far as what they're doing, who they're going, how many people they're tracked, how many people they've communicated with. So I have a template that I send them, basically with questions, like things that I need to know, and they report to me every month. It's kind of tough, sometimes getting them to do it, but that's like Lance. I kind of oversee all of them. I'm also boots on the ground, but I also oversee these other agencies that are reporting to me. So that's pretty helpful.
Fantastic. Anybody else like to share?
Susanna, I was just going to ask you, do you work with Little Havana Activities and Nutrition Corporation by any chance? They're one of our partners.
Healthy Little Havana?
Little Havana Activities and Nutrition, they work with the elder population. So it might be a different population.
Let me write that down because I would because
we're
we're in the Homestead.
Yeah.
Southern.
Okay.
But
yeah.
I did partner with that area, but with a previous grant we had. So can I jot down that name again?
Yeah, sure. Little Havana Activities and Nutrition Corporation.
Activities and Nutrition. Beautiful. I can
text.
How are we keeping our communities updated on the latest information about COVID and the flu? Tell me, what are you doing in your communities to help your community and keep them updated? What tools are you using to help people get this information? That may help us. We might help us to do better. Kind of, what are the tools are you using?
A lot of what I'm Mike from Allegheny County in
Hi, Mike.
Pittsburgh. And so I don't work on this directly. I supervise someone that does, but she couldn't be on today. But basically what we've got a lot of trusted messengers, you know, a lot of the things that other people were saying, and we come to a lot of these meetings, we synthesize the information, we send out weekly reports, and we have a lot of mini grantees that are the ones doing the actual community engagement. So they're the ones that are putting out the posts. We've got like the trusted doc, you know, like our Facebook Live with a doc asking questions, and those tend to get a ton of views. Again, I don't have all the like specific data right in front of me, but that engagement really works in our area. And so, yeah, just like staying in constant communication with our partners. We have a monthly meeting like every 2 months, and then on the off months, we meet directly with every one of our mini grantees. And then we've actually been able to kind of like combine some of our reach work with our iReach work lately, which has been pretty cool as well. So we're kind of like right on the cusp of that. So yeah, I think that we're going to continue to expand the level of, I always use the word reach, but we're going to expand our reach, you know, as we continue to like create a platform for our mini grantees to kind of collaborate. So I hope that was relevant.
Very relevant, Mike. I appreciate you taking the time out just to come in and tell us exactly what you all are doing. And we're going to hope that we can use some of those same resources that you guys are using in your community. I know there got to be some other folk on with us right now. Well, just tell us kind of, what are you doing as far as communicating? I think everybody else is us. Just outside of Mike, I think everybody else is care. Jennifer, actually, since we are on this call together, we're going to help you out, Mike. This is our deputy director with CARE. Her name is Debbie Vitalis. So she's actually with CARE as well. So everybody on our channel right now is from CARE, except for to you and Mike. Mr. How do you say your first name? I don't want to mess that up. Khadijah. Please pronounce that for me so I don't mess it up.
It's Khadijah Salam.
Khadijah Salam. Thank you, because I would have messed that up, Khadijah. I'm just going to be honest with you.
Okay.
So Khadijah, kind of help us. Tell us kind of what you guys are doing in your neighborhoods to kind of communicate to keep people updated.
Well, I'm new to the project, but I know that there were quite a few connections with the churches and various community partners. But I do have a question for you all that I would like some help with.
Yes, ma'am.
How have you all communicated, and what response have you gotten since now that children can be vaccinated?
You know,
and so I think that's really crucial, because parents have been so horrified by this, and I think that's really, really important. So I'd like some ideas from you all about that.
Jackson, you want to step in with that one?
Yeah, I think, you know, there's there's several things to think about, but one is, you know, identifying what concerns parents have and kind of anticipating those. You know, it's a lot of the, you know, fear of the unknown, you know, long-term side effects. But, you know, so part of that is just doing, you know, some health education so they understand, you know, more about how these vaccines work. But for more just immediate like messaging, like for social media or something, really it's important to frame messages and have an emotional appeal. So, you know, making sure that your message is really tying in, like, you know, the values that you both share. And so, you know, you parents want to protect their kids. And so trying to have messaging and graphics that kind of get at that. And then I think it's important to, you know, show local providers or pediatricians, you know, in those ads as well, just to show that it is supported by providers and experts in this field.
And just to add a bit more to that, as you stated, Khadija, people are scared. Anytime you get anything that comes into your community that you're not used to, when it comes to medical equity, which leads into vaccine equity, when you experience a lot of things that are unfair, it mounts hesitancy. And with parents, like Jackson said, people are sensitive. So your message has to be sensitive. Parents are just flat out scared of just putting anything into their kids. When you think about, when kids go to school and they have to be vaccinated, and how difficult sometimes it is to get parents just to do the basic vaccinations that students have to even go to school. We have parents that fight against that due to thinking their kids are going to be affected by it and come down with other diseases or other things that may happen to them because of the vaccination or the vaccine that we're offering. And so we see that a lot. So the same problems you having in your community, believe it or not, we're having in ours too. I think those things are happening across this country where parents are just flat out not in the position to believe that this is something they should be doing with their kids. But the thing is that I truly believe in just constant information, constant providing the facts, as I said in my presentation, is providing truthful information and using, as Mike said, Mike, I appreciate your comments, using trusted messengers. We also have trusted messengers that we train. We train local health centers, we train local FQHCs and agencies in our city to become trusted messengers, because people would actually believe them before they believe one of us that they don't really know all that well. So carefully having people in the community to speak on your behalf is key to get to those parents. You have a trusted messenger that live next door to you, have that person speaking to the parents in that community about this information if they actually believe it themselves. That way we can get that message across and make it more effective.
Thank you so much. Thank you.
And that's what we do. So Khadija, I'm just curious, since you're so new to this, kind of what would you say are examples of effective ways to track ongoing conversations with individuals in your community? How are you going to approach the people in your community? Now that you knew, I know you probably were thinking of ideas of things that you would like to start with. Kind of share some of them ideas with us.
Okay, I think you asked me two questions: how to track and how would I approach people?
Right, tracking and ongoing conversations with individuals in your community. How would you track those conversations, and how would you begin to start that process?
I think I would start, I think the youth are good to inform and carry messages, because I don't know that we, from my experiences, that we include the youth all the time. When I say youth, I mean like young people, maybe even from middle school to high school and early college. So I think being in their spaces and getting their understanding. Also, definitely any type of community health fairs, any type of events that way. And in terms of the tracking, when people attend events, sign in, collecting their information, even when kits are.
Looks like we are all back. We don't have a ton of time for report outs, but just a few minutes. And so one thing I want to tell you is that while we're talking, we're going to launch a poll at like the 1 minute mark, probably before 1 p.m. because it only takes a few seconds. So be ready to see that, and please do it before you close the meeting. And then I'll also chat out some of our upcoming events. But from our facilitators in the rooms, do you all want to, in just a few, like 1 minute, tell us maybe some of the common themes or what you've heard come up that maybe a majority or several of your breakout participants seem to be some lessons or things that they might have been struggling with based on our discussion questions?
Well, I'll just jump in since we're not going in order. This is Bernard Macklin, and quickly in ours, the biggest thing is what Mike shared with us, and also glad he spoke, was definitely using trusted messengers was kind of one of the key areas. Using documents, using media, a lot more TikTok and Facebook and Live and all of those type of media outlets to get messages out, using pastors, getting with your local churches. And talking to their pastors to speak with their congregations. We also spoke really quick about tracking information. Khadijah brought up some very good points that she was talking about using kids and young people more often than we're using them to get this information out to young people, because that in our epidemiology reports, it shows that our numbers are really low when it comes to getting young folk vaccinated, especially those 6 months now to 17. She spoke about using, getting them to actually help them to understand the information so they can put it out, using kits, using the sign-in as far as tracking, using sign-ins and kits and numbering those things so you know exactly how much information that you had given out to the community. And that's all we really got to, and that 10 minutes went very fast. Thank you.
They go fast. How about
in our group, I'll just
ahead,
jump in
Carol. Thank you.
quickly. We did talk about the use of key influencers, and what was kind of echoed at this point is really not so much the development of more information, but specific skills like MI skills, motivational interviewing skills.
In our groups, we spoke about things such as creating events and maybe not using COVID as a direct pulling in of people, but being creative and kind of saying healthcare and maybe engaging people a different way, and some creative ways to engage people through, advertisement like billboards or, social media and those type of things. So that's a quick summary.
Quick summary from us. I think it was a lot of stuff that was also discussed in other groups. However, we learned about some really cool Google ads and how to use geo fencing to send those out. And so Lance, thanks for sharing those. And then we also learned about some tracking within our community members and sending text messages to people to remind them to get their next shot in a series, and how that's been working really well for another group that was with us. So thank you.
Thank you, facilitators. We did it. Wow, it was a really fast report out. That was great. So I just chat. So the satisfaction poll is up. Again, we'd really appreciate if you could answer the poll question before you take off. And before anyone else takes off too, just a big thank you to our speakers and facilitators. We will have another one of these sessions on August 2nd. That's the first registration link I just posted. And it will be completely different set of speakers and topics. And so I encourage you to come to that one, even if you're right here in this one. And then on the 15th, we have another event, a webinar focused on health insurance coverage. So just understanding the confusing landscape of health insurance coverage, and then also how to connect your community members to affordable health insurance as you're also doing your vaccine equity work. Registration is not open for this next one yet, but it will be very soon. We are repeating our workshop, our social media workshop series. We did it in February. There were 4 sessions. And so this is a repeat of that. So if you already went to the February sessions, you're probably not going to be interested in going to these. But if you were not able to do the February sessions, then I encourage you to take a look when registration does come out to see if this is something that you might be interested in. Spots are limited to somewhere, they'll be between somewhere in 30, 35 seats open at each session. They stand alone. You don't have to sign up for all 4. But feedback from the February series was that it was very helpful. So those of you who are interested in gaining some social media skills, keep a lookout for that. And we are exactly at the 1 p.m. mark. I see Bernard, you're chatting your information. Thanks for doing that. But we'll make sure that anyone who attended this session has all the contact information for the speakers, and we'll also include that in the materials we send out to everyone else. So again, thanks all. And yes, thank you for the recommendation to be longer. We hear so much feedback on longer versus shorter. So we really are trying to hit the sweet spot, but that is good feedback for us. And I agree, it felt short on the report out. So we will take that and reconvene as a team and figure out what we can do to allow for more discussion time and to hear from a diverse group of programs. So have a great rest of your afternoon, everyone, and thank you for joining us today.
Thank you.
Take care, everyone.